Chickenpox might sound harmless, but it's far from it. Before vaccines, chickenpox caused over 10,000 hospitalizations and about 100 deaths every single year in the United States alone. And here's the terrifying part. Even today, adults who catch it are 25 times more likely to die than children. This virus isn't just an itchy rash. It's a full-body attack that can lead to pneumonia, brain swelling, and even long-term nerve damage. If you think chickenpox is just a childhood inconvenience, you need to hear this. In this video, we're breaking down the real story behind chickenpox, the causes, early signs you must not ignore, how doctors catch it fast, and the treatments that save lives. Before we dive in, let me know in the comments, where are you watching from today? Now, without any further ado, let's get started. What causes chickenpox? Chickenpox is caused by a virus called varicella zoster. It's part of the herpes virus family, which is known for sneaky infections that stay in the body forever. Once you catch chickenpox, the virus never really leaves you. It hides deep inside your nerve cells, sometimes for a lifetime. The way you catch chickenpox is surprisingly easy. It spreads through tiny droplets when an infected person coughs, sneezes, or even breathes near you. You can also get it by touching something contaminated with the virus, like bedding, clothing, or doorknobs. What's shocking is just how contagious it is. If one person has chickenpox, up to 90% of the people close to them who aren't immune will get infected. That makes it one of the most infectious diseases known to medicine. Another frightening detail is that you can start spreading the virus before you even break out in a rash. That means by the time you notice the symptoms, you may have already passed it to family, friends, or classmates without realizing it. Signs and symptoms of chickenpox. The first signs of chickenpox are sneaky. It usually starts with a mild fever, fatigue, loss of appetite, and headache. Most people assume it's just a regular cold or flu at first, but within a day or two, the signature chickenpox rash begins to appear. The rash typically starts on the chest, back, or face and quickly spreads across the entire body. Small, red spots appear first. These then turn into itchy, fluid-filled blisters. After a few days, the blisters break open, leak fluid, and then crust over into scabs. New waves of blisters can keep appearing for several days, making it feel like the illness is dragging on forever. What makes chickenpox particularly miserable is the intensity of the itching. Scratching the blisters can lead to serious skin infections, deep scars, and even more complications. And here's something many people don't know. Chickenpox isn't always mild. In adults, infants, pregnant women, and people with weakened immune systems, chickenpox can cause pneumonia, brain inflammation called encephalitis, and severe bacterial infections. Even after the rash heals, the virus stays dormant in the body, waiting. Sometimes, years or decades later, it can reactivate as shingles, a painful, blistering rash that can lead to permanent nerve damage. Diagnosis of chickenpox. Diagnosing chickenpox is usually straightforward. Doctors can often tell just by looking at the rash. The combination of red spots, fluid-filled blisters, and scabbing is so distinctive that it's hard to confuse it with anything else. But in some cases, especially early on or in people with atypical symptoms, tests may be needed to confirm the diagnosis. One common test is a PCR, polymerase chain reaction test, which detects the virus's genetic material from a sample taken from a blister or a blood test. Sometimes, doctors use a direct fluorescent antibody test to identify the virus faster. It's important to catch chickenpox early, especially in high-risk patients. Starting antiviral treatment quickly can help reduce the severity and prevent serious complications. Plus, early diagnosis helps stop the virus from spreading to others, which is critical because chickenpox can still be deadly even today. But before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Treatment of chickenpox. Most people with chickenpox recover with simple home care. The focus is usually on relieving symptoms and preventing complications. Staying hydrated, getting lots of rest, and keeping the skin clean are essential steps. Over-the-counter pain relievers like acetaminophen can help control fever and discomfort. But aspirin should never be used in children with chickenpox because it has been linked to a rare but deadly condition called Reye's syndrome. To manage the intense itching, doctors often recommend using calamine lotion, antihistamines, and oatmeal baths. These can help soothe the skin and make the illness more bearable. It's also crucial to keep fingernails trimmed short to prevent breaking the skin when scratching, which lowers the risk of secondary bacterial infections. In severe cases, or for people at high risk of complications, antiviral medications like acyclovir can be prescribed. These drugs work best when started within 24 hours of the first rash appearing. They help slow down the virus and reduce the severity of the symptoms. In some hospital settings, patients with life-threatening cases may need intravenous antivirals, antibiotics for secondary infections, or even intensive care support. One of the biggest advances against chickenpox has been vaccination. The chickenpox vaccine, introduced in the 1990s, has dramatically reduced the number of cases and complications. It's about 90% effective at preventing the disease and almost 100% effective at preventing severe cases. People who still get chickenpox after being vaccinated usually experience a much milder illness, often with fewer blisters and less fever. Complications of chickenpox. While most people recover without problems, the potential complications from chickenpox are serious enough to take it very seriously. Bacterial infections of the skin, soft tissues, and bloodstream can happen if blisters are scratched open and bacteria enter. Pneumonia, especially in adults, can develop and can be severe or fatal. Brain complications like encephalitis, cerebellar ataxia, loss of coordination, and stroke have been linked to chickenpox infections, even in healthy children. In rare cases, the virus can cause death, especially in newborns, pregnant women, and those with weakened immune systems. One of the most devastating long-term consequences is shingles. After a person recovers from chickenpox, the varicella-zoster virus lies dormant in the body's nerve tissue. It can reactivate years later to cause shingles, which comes with severe burning pain that can last long after the rash is gone. This lingering nerve pain, called postherpetic neuralgia, can last months or even years and seriously impact quality of life. This is why vaccination, early diagnosis, and careful management of chickenpox matter so much. The virus may seem harmless because most people only remember it as an itchy childhood illness, but in reality, it can unleash damage that lingers for decades. Preventing chickenpox. The best defense against chickenpox is vaccination. The vaccine is typically given in 2 doses, starting in early childhood. But adults who've never had chickenpox or the vaccine should seriously consider getting vaccinated too. Protection is especially important for healthcare workers, teachers, childcare workers, and anyone in close contact with vulnerable populations like newborns or immunocompromised individuals. If someone in your household has chickenpox, the best way to prevent spread is strict isolation. The infected person should stay home from school, work, or public places until all the blisters have scabbed over, usually about a week after the rash appears. Frequent hand washing, avoiding contact with pregnant women and immunocompromised people, and disinfecting surfaces can also help minimize the risk. For people exposed to chickenpox who are at high risk of complications, doctors may recommend post-exposure prophylaxis with the vaccine or an immune globulin treatment. These steps can sometimes prevent illness or at least make it much milder. Chickenpox isn't just a relic of the past. It's a powerful virus that can still cause real harm if ignored. From a simple rash to life-threatening complications, the range of outcomes depends on how quickly it's recognized and managed. Thanks to vaccines, chickenpox is far less common today, but it hasn't disappeared, and when it strikes, it can still hit hard. Knowing the causes, the early symptoms, and the right treatment steps can protect you and the people you care about. Whether you're a parent, a teacher, or someone who just wants to stay informed, understanding chickenpox today is still as important as ever. Now, we want to hear from you. Have you or someone you know ever had a serious case of chickenpox? Were you surprised by how bad it could get? Drop your experience in the comments below. We love hearing your stories. And if you found this video helpful, hit subscribe so you don't miss more honest, science-backed health breakdowns just like this. Thanks for watching.